What causes delays in stroke swallowing assessments? Imagine suddenly having trouble swallowing after a stroke and wondering why it takes so long to get checked. Delays in swallowing assessments are common and can happen for many reasons. First, patient factors play a big role. Some patients are too unwell or not alert enough right after their stroke to safely undergo swallowing tests. If they are heavily medicated or have a reduced level of consciousness, healthcare providers might need to wait until they are more stable. Sometimes, the signs of swallowing difficulty are subtle or hard to spot, especially if the stroke presents in unusual ways or if the initial diagnosis is not clear. The location and severity of the stroke also matter. For example, strokes affecting the brainstem or basal ganglia can impact swallowing reflexes, making assessment more complicated or delayed. Staff factors also influence timing. Not all healthcare workers may be trained specifically to recognize early signs of swallowing problems. Junior doctors or nurses might not always be aware of the importance of quick screening, or they may not have the training to perform detailed assessments. Speech and language therapists, who are experts in swallowing evaluations, may not always be available 7 days a week, which can cause delays. Limited staffing levels and resource constraints within hospitals can also slow down the process, especially during busy times or in smaller facilities. Service and system issues contribute as well. Hospitals need clear protocols to ensure swallowing screening happens within 4 hours of a patient's admission, and comprehensive assessments are done within 3 days. If these protocols are not well established, or if resources are stretched thin, delays happen. Sometimes, delays in confirming the stroke with imaging tests like CT scans or MRIs can also push back the timing of swallowing evaluations. Timely assessment is vital because it helps prevent complications like pneumonia, which can be deadly for stroke patients. Guidelines recommend screening patients as early as possible, ideally within 4 hours of admission, and arranging a full assessment by a speech and language therapist within 3 days. Hospitals can reduce delays by improving staff training, creating clear procedures, and ensuring enough resources are available. Recognizing that each patient's condition varies is important, and assessments should be tailored to individual needs. In summary, delays in stroke swallowing assessments happen because of patient health status, staff training and availability, and how well hospital systems are organized. Addressing these factors helps ensure patients get the timely care they need to recover safely and reduce serious complications. Always remember, if you or a loved one experience a stroke, quick action and proper assessment are key to better outcomes. For personalized advice, consult healthcare professionals who can evaluate each case carefully.